Hello, and welcome to the Body Fusion Therapy Podcast. I'm your host, Dr. Heather Demirci. Spring is in the air, and it seems like around this time every year, my social media is filled up with my friends and family that are announcing that they are expecting. So today's episode, we're going to talk about pregnancy. Now, being pregnant is hard enough without adding the unnecessary aches and pains that can come along with it. So in this episode, we're going to talk about the different trimesters and what to expect from your body, common pains that can occur like round ligament, low back, and pubic symphysis pain, and finally, what you can do to prepare for labor and delivery. Let's start off with talking about trimester 0. Now, when I say trimester 0, I'm not talking about people that are having struggles with fertility. I did do a whole podcast episode on infertility and what manual therapy can do to help those families. This is more about you're ready to get pregnant, you're not worried about any issues with getting pregnant, and what can you do to set up your body to be in the most efficient, optimal shape to allow for an easier pregnancy. Because it's a lot easier to fix some problems before you get pregnant that are kind of underlying issues rather than trying to fix it when you're already pregnant and we're a little inhibited by what we can treat. And then also, as the baby grows, there's just not as much space to be able to treat some of these dysfunctions. I think it's a great idea when you're about to start to try to get pregnant to see a physical therapist first. And I think the key areas to kind of focus in on is if you already have some aches and pains, trying to figure out how to alleviate those because they're just going to get worse when you get pregnant, most likely. But then also making sure that your pelvis is in a nice neutral alignment, that it's not elevated or rotated or kind of compressed in on one side. Another area that would be really important is good bladder mobility because Lord knows every pregnant woman is going to be peeing so much. But it's hard to treat the bladder after you're already pregnant. So you want to make sure that you have good bladder mobility prior to that. It can expand fully. So maybe that will hopefully limit the number of trips you have to take to the bathroom once you're pregnant. So you want to make sure that all the fascia around the bladder is moving properly, that it can be elevated. It can go from right to left to right, come forward, go back. Just mobility in all different directions. Trimester 0 is also another great time to avoid getting a diastasis recti. Many of you might have heard of this, but for those that haven't, a diastasis is when there's a splitting of your abs. So the splitting of the abs happens with the muscle called the rectus abdominis, or what is known as your six-pack abs. So as the belly expands, naturally all your abdominal muscles are going to have to flow outwards too. And a lot of women will get this separation right in through the middle, which becomes a problem later on because it's showing core dysfunction that you're having through your system and can lead to other issues like low back pain or urinary incontinence. There's kind of a whole gamut that can happen from the splitting of these abdominals or a diastasis. So before you get pregnant is a great time to try to improve some mobility of a few key structures to try to avoid getting the diastasis because yes, it is very common to get a diastasis during pregnancy, but it doesn't necessarily need to be that way. There are 2 key structures that I suggest you have assessed and treated during this trimester 0. So the first one is the outside border of that muscle, the rectus abdominis, or your six-pack abs, because that goes longitudinal through the body. So it goes from underneath, like right at the lower border of your rib cage down to your pubic bone. And it's the tissues are going more up and down your body rather than transverse or perpendicular to your body. So clearing up the lateral borders or the outside borders of the rectus abdominis can help to improve then as the belly starts to expand that you'll get the sliding of the tissues underneath going outwards, but you won't have them then getting pulled out as well. So I see often happening that the lateral borders, the outside borders of that rectus abdominis are kind of attached to the external obliques underneath. And that's what's kind of an anchoring point that then splits open those abs. So if you can kind of get in that superficial layer and clear out the lateral border of that rectus abdominis, it will decrease your chances of getting the splitting of the linea alba and getting that diastasis. Another key area to get treated for avoiding a diastasis is the mesenteric root. Now, I'll probably do a much longer, more in-depth analysis of what a diastasis is and how to help it. But basically, the mesenteric root is what holds and suspends the small intestines within your abdominal cavity. I like to think of it as a tree. So the loops of the small intestine, which are there about 20 feet of loop, are the leaves of the tree. And then it goes to the branches, which is the mesentery. And then those branches go back to the mesenteric root. You might be wondering why the mesenteric root is important when it comes to the splitting of the abdominal muscles. And that's all based on a case series study that was done by Brandy Kirk and Terry Elliott Burke, in which they looked at cadavers and saw that those fibers of that mesentery going back to the mesenteric root that goes to kind of the back of the peritoneal cavity or your back wrap around the long sides of you and actually attach near the lateral border of the rectus. So if that mesenteric root is pulled forward, if it's restricted, it will actually cause a separation of the abdominal muscles. And so if you can get good mobility of that mesentery, you'll actually see the separation decrease. So the mobilization of the mesenteric root is how I treat patients when they already have a diastasis. But if I have a patient coming in that wants to get pregnant and is trying to get her body in an optimal form to allow for the expansion that's needed while staying efficient, then I'm also going to be treating that mesenteric root to make sure it has good mobility. The hope is that if you can treat these two areas of the lateral borders of the rectus and also the mesenteric root, that you will avoid getting the diastasis as your belly starts to grow. So that's kind of trimester 0. I think it's really important to be prepared. It's a lot that you're about to ask of your body to be able to grow another human inside of you. So why not make sure that you're ready for that battle and that fight before it even begins? So once you're now pregnant, you're in the first trimester. And I'm sorry to say it, but in the first trimester, I'm not going to treat anything in your abdomen, nor should you really have any part of your abdomen treated, because you want the baby to be able to implant. That's why I think it's so important that you see a PT during trimester 0 to try to deal with any of these aches and pains or dysfunctions you're already dealing with. Because during the first trimester, there's not much that we should do for you because you want to have that safe implantation of the baby and not kind of cause any sort of alterations that might lead to a miscarriage. What you'll be feeling in this first trimester is the breast will start to enlarge. So you might start to get some pain in your neck and also pain in your kind of in between your shoulder blades. There'll be lots of bloating thanks to the changes of the hormones. You'll also, because of those hormones, you'll be peeing a lot more. That's why I think it's important to have your bladder mobilized prior to, so that because you're going to be urinating a lot more from the pregnancy hormones, at least your bladder can fill up more so that you won't be making as many trips. This is also, unfortunately, the time that morning sickness can be happening. And the bad thing about morning sickness is that it's not usually just the morning. It could be all day, or it could be any part of the day. So you'll have some nausea and vomiting. You'll also feel very fatigued. So you'll be very tired, wanting to take more naps. And what other thing's going to happen is you're going to start to feel more loose and more flexible. And that's because of a hormone called relaxin that's going through your body. Now, relaxin's there to start to relax the ligamentous structures of your body so that it can start to expand as a baby is growing. So this is another reason why I think it's really important to get your body treated in trimester 0, because if you already have some dysfunctions, especially of your low back or within your pelvis and your hips, it's going to be even more exaggerated now that you're pregnant because of the relaxin. You're not going to have that ligamentous stability that you used to have. Those muscles are going to have a much higher demand of trying to create stability now that you don't have the ligaments, which are usually that underlying structure of stability. So it's important to get everything treated prior to getting pregnant because it's just going to make it a lot easier as you start to get bigger. At the end of the first trimester, your uterus is just coming over the pubic bone, and the baby is about 3 to 4 inches long. In the second trimester, that's usually when you start to feel a little bit more comfortable. This is usually the best of the 3 trimesters. Second trimester is also when you're able to be treated again safely, where there's not the concern of anything happening to the baby because it is fully implanted within the uterine wall. The body will start to stretch even more and you'll start to look more pregnant. What you're going to start to feel is hopefully the morning sickness will start to subside and you'll start to get more energy. So you'll be able to kind of take on all the tasks that you had to put aside during that first trimester when you weren't feeling so good. Unfortunately, though, this is when you start to get more pain in your groin because of round ligament pain. So the round ligament is a piece of fascia on each side of the uterus that goes from the uterus to the groin and then attaches to the pubic bone. So women that are having round ligament pain will say that their groins, there's a pulling and a tension in through there. And it makes sense because as the uterus is growing up into the abdomen, that if that round ligament doesn't have good mobility, it will start to pull onto the pubic bone and cause a lot of pain. The nice thing about the second trimester is that now it's safe for you to have that area treated to hopefully get some stretching of that round ligament to decrease the pain, because the uterus is only going to keep growing up and that round ligament will continue to be stretched and strained. So it's important to get good mobility in through the round ligament, safely done with a physical therapist treating that area. Low back pain is also a factor I see coming in during the second trimester, especially towards the end of it. Because as the baby is growing and getting bigger, you're starting to feel more pressure, your posture is starting to change, center of gravity is a little different, and low back pain will start to occur. This is when postures can become really important. With good posture, your core is going to be firing properly, which is going to help protect your low back pain. I also have a whole other episode on the core and the importance of true core activation to protect the lumbar spine. You also might be noticing that sleeping can become a little bit more painful. This is a great time to bring in a pregnancy pillow. What I like about pregnancy pillows is that it fully supports the growing body in all areas, from your head to your neck to your shoulder to the belly itself and down and through the hips, knees, and ankles. It's important to find a pregnancy pillow that can kind of wrap around you. I like more of the C-shaped pillows rather than the U-shaped pillows, because I want the pregnant woman to be able to have the support of her entire legs. When you're placing a pillow between your legs to sleep, because you're going to be sleeping on your side more now, it's important to have a pillow supporting all the way from the ankles to your pubic bone, not just your knees. If you just have your knees supported on the pillow and then your ankles are touching each other, it's actually going to be causing a torsion on your hips and on your pelvis that isn't going to feel good in the morning. The C-shaped pregnancy pillows do a better job of being able to support all the way from head to toe. What I like about the C-shaped pregnancy pillows as well is the fact that you can have your belly supported as well. You'll find as you start to get larger and the pressure on your hips is increased, lying directly on your side isn't going to be as comfortable anymore. You'll start to get pain right onto your hips. And so being able to roll back just a little bit is really effective. So with that rolling back, you want to have your belly supported though, because if you were to feel what happens when you are directly on your side and then just lean back a little bit, you'll feel the weight of your belly kind of pulling down back towards the bed. And that can pull on your lumbar spine and make it really painful. So having that pillow underneath you can help support and lift it up a little bit so you don't have that pulling on your low back and you're able to get off the side of your hips. So I love the C-shaped pregnancy pillows. The U-shape, I just don't feel like it's as useful in terms of what all the different areas that it can improve upon with your body and make it more comfortable for sleep. At the end of the second trimester, your uterus is now up over the level of your belly button, and the baby is about 13 to 16 inches long, so it's starting to get bigger. Welcome to the third trimester. You are almost there. You're in the home stretch. I always joke that the end feels like time just slows down so much when you're pregnant. That last month of pregnancy is like 9 months in itself. For me personally, I had 5 other friends that were due after me. One was due on my due date as well, but 4 other friends were due after me, and every single one of them had their baby before I had mine. And it was just painful to watch because I was just growing bigger and being a little bit more uncomfortable, and I just wanted that baby out. So be prepared for the third trimester to be not the funnest ride out there. What you'll start to feel is that you'll be a little bit more uncomfortable again as your body starts to grow. You might have more acid reflux. You also can't eat as much because there's not enough room in your abdomen as the baby's growing, because what used to be just your intestines in your abdomen is now a baby and your intestines. So there's just less room for mobility there. Your hip pain might start to get worse, especially since you've been sleeping on your side for quite a few months now. Low back pain is also going to unfortunately get worse as you start to grow. This is when also sciatic pain can start to kick in. And the dreaded symphysis pubis dysfunction, or SPD, can start to kick in. That is, if anyone has ever known anyone or you yourself had pubic symphysis pain, it is terrible and can be very incapacitating where women no longer want to walk anymore because every single step or even just being weight bearing, being up is so painful right there in their crotch. So pubic symphysis pain, what is it? It is the stretching of the pubic symphysis, which is a cartilage joint between the two sides of the pelvis. Now, it's going to have to stretch when you give birth. That's what kind of helps open up through the pelvis to allow the baby to go through the birth canal. But if it's stretching too much, it just gets really irritated and makes it very hard to walk naturally. And it will really limit women. I've even seen women that have had to use walkers and crutches and canes just to try to be able to move about through the house. It's really important to work on posture during this time. It starts to become important in the second trimester, but really this third trimester, if you haven't already started to work on it, now is the time. It'll start to take pressure off of the low back, the sciatic, and also the pubic symphysis. We're in a society and honestly a generation right now that loves showing off their pregnant bellies. I mean, our mother's generations and our grandmother's generations, they all wore the really baggy clothes to try to hide their belly. And now we all wear the tightest clothes possible to show off that belly. Now, that leads to dysfunction because of trying to show off the belly. And I get it. I wasn't asked if I was pregnant till I was in my 7th month, which just killed me. I wanted someone to ask that I was pregnant because you just feel big, you feel uncomfortable, and you want it to be because of a good reason, like you're pregnant, not just because you've let yourself go. But the problem with trying to show off your pregnant belly is that a lot of women do it by then extending out and having a big sway in their low back. And now that baby is sitting outside the pelvic girdle and just pulling on all of the tissues and all the attachments that are going into their pelvic floor and into their low back. And that's where problems can occur. It's important that the baby is sitting within the pelvic cavity. That weight of having the baby in the pelvis actually helps the pelvic floor muscles fire. And if you remember from my episode of getting to the core, we need to have all those muscles firing properly for everything to fire. If you have one that's not firing, then it's really inhibiting the ability for the entire core to be activating and being efficient. So we want to get the baby sitting back into the pelvic girdle more easily. How do we do this though? The greatest way is actually to do this exercise where you're going to be up against the wall with your back against the wall and your feet about a foot and a half away. You're going to have your hands underneath your belly and you're going to arch and sag your back. So you're going to try to pull your back away from the wall and then press your whole lumbar spine to the wall while you're gently lifting your belly up. So we're just trying to unweight the belly from the lower part of your abdomen. So you're just going to kind of be rocking back and forth, arching and sagging your back. Well, then once you kind of feel like your hands have lightened a little bit, that the baby's moving a little bit more, then as you arch and sag your back, you're going to try to gently push the belly back in. You're going to try to push the baby kind of up into the back of your back. This will allow the baby to move back into that pelvic cavity where he or she should be and not hanging out in front of you. It is amazing to see if you do this technique correctly, how you might go from looking 9 months pregnant to 6 months pregnant again. And what you'll see is that your lumbar spine, your low back is no longer have a huge sway in it, but it's more in a neutral position. And this is what we want. We want it to have a neutral position. This will really help your pubic symphysis pain as well, because if you can get those core muscles to fire, including your pelvic floor, then it will allow for the tightening to happen and you won't have as much motion through that pubic symphysis, through that cartilage joint, and it will decrease the irritation through there. If you're still having issues with kind of pelvic pain, SI joint pain, pubic symphysis pain, you might want to use a belt, an SI joint belt. There's a lot of like belly bands out there for pregnant women. I'm not the biggest fan of them because they're not really helping to support the structure of the SI joint. They're just trying to unweight the baby without improving your structural alignment at all. So I like these SI joint belts that also have a baby support. So at the SI joint belt, it's going around your pelvis and trying to squeeze it in a little bit, because with that relaxin going really strong through your body right now, all those ligaments that were holding the sacrum and the two sides of the pelvis together are really loose now. So you need almost this external fixator to be able to pull it all back together again, which is yet again going to allow for your core to function more efficiently. So if you're going to have to get a belt, I would find one that's not just a belly band that's just supporting the baby, but get an SI joint belt that's also for pregnancy, so that you're doing the best of both worlds. You're supporting your pelvis while also taking the weight off the baby, and also do that exercise against the wall. It is great just to relieve your low back pain. And any pregnant woman that gives it a try can really tell a difference instantly how their body's able to function and the pains and stresses that is being put on it from the pregnancy. Now, the uterus keeps growing up and up until the baby drops down, which happens about 2 to 4 weeks before delivery. This is not a good predictor of impending labor, though. So don't think that as soon as the baby drops, that this is when you're going to be going into labor. No, you could still be a month out. Now, if the baby drops, this might really be when you need that SI joint pain, because all of a sudden that weight of that watermelon basically that's now inside of you has plopped right down inside your pelvic girdle. And you're going to need to have that structure of the outside SI belt trying to kind of close in to tighten around your core. Now you're at the end of that 3rd trimester. The baby's going to come soon. What are some things that you can do to help kind of set yourself up for a good labor and delivery? Well, I would say go in and see your physical therapist and get a good mobilization of your tailbone or your coccyx. You want the tailbone to be in alignment, because if it is side bent, rotated, flex, extended, whatever, if it's not in neutral alignment, you're going to feel it when you're trying to push a baby through that canal now, especially if it's flexed forward. So you want to make sure that it has a nice neutral alignment, so that's not going to be impeding the ability for the baby to come out or to get damaged in the birthing process. I've actually had multiple patients that have fractured their tailbone during labor and delivery. You don't want that to be you. And if you can have your tailbone in a nice neutral alignment, that will definitely help. People ask me about massaging the perineum to help so that they don't tear during pregnancy and delivery. But research doesn't really show that it helps much of actually massaging the perineum. What I think helps more is getting that tailbone in neutral alignment, because all your pelvic floor muscles are attaching onto that tailbone. So if you have a good neutral alignment of that coccyx, the tailbone, then you're going to have good spreading. Because if you already have a tight pelvic floor on one side, because maybe that coccyx is over to the opposite side, it's stretching those pelvic floor muscles on one side. That's not going to allow for good stretching, optimal stretching, and not tearing in through the perineum. Because if it's already on stretch and now you're trying to push a baby through it, it's going to get stretched even further, and it doesn't have the ability to do that. Something will have to give. So rather than taking the time to mobilize and to massage the perineum, go get your tailbone put into neutral. I think that's going to have a much better effect on your labor and delivery than if you just try to spend your time massaging the perineum. This is also a great time to keep the uterus mobile too, to keep it have a good mobility in all different directions. This is when you can be getting up against the wall and trying to do that arching and sagging of your back. It just kind of unweights the uterus a little bit, anything that it might be stuck and adhered to because it's just sitting in your abdominal cavity. You want to have good mobility in all different directions, which will make it easier when you're trying to push. Another thing you might not think about to make your life a little bit easier would be to have your mid, back, and your neck worked on, because when you're pushing, it most likely, if you're giving birth in the hospital, you're going to be on your back and you need to have your head up while you're pushing, kind of bearing down and through there. So if you have neck pain or limitations of your upper thoracic spines, like upper shoulders and neck, that will inhibit your ability to get in the position needed to have that bearing down motion to be able to push the baby out. So even though it seems like, why would I have my head and neck worked on and upper shoulders to help with labor and delivery? It is important because you want to be able to use those core muscles that are also all the way up in your neck to be able to improve your overall pushing to have a more effective delivery portion of the labor and delivery process. Hopefully these tips and tricks will make it easier in the labor and delivery process, and then you'll have a wonderful baby to hold on to afterwards. My next episode will be on what happens postpartum or after the baby comes out, different areas that need to be treated, different dysfunctions that can occur, and how to make them better. I hope you see from this episode, though, that it is important to, prior to when you want to get pregnant, to get a lot of these dysfunctions treated beforehand and putting yourself in the best position possible to get ready for the effects that's going to happen with having a pregnancy, because it is a lot that you're asking of your body. And there's things that can be done to help treat you during the pregnancy, to get you more functional, to get you moving better. But it's also important to address these issues prior to getting pregnant. Don't feel, though, that when you're pregnant, you're just going to have to go through these aches and pains because it's the rite of passage that should occur for every pregnant woman. It doesn't need to be that way. And I hope you see from today's episode, there's a lot you can do to make your pregnancy a happy one. Thank you for tuning in to this episode of the Body Fusion Therapy Podcast. Please share it with your friends and family, as well as leave a review if you liked what you heard today. We're looking forward to continuing this journey of looking at the body. Tune in next time.